Hello, and welcome to the School of Health Sciences Virtual Open Day and this presentation for the Bachelor of Midwifery undergraduate programme. My name's Julie Roberts and I am one of the midwifery lecturers here at Bangor University, and I'm also admissions tutor for the department. So if you do decide to make an application, it may be me that you will be contacting or liaising with, and I'm happy to answer any questions from prospective applicants. So why choose Bangor University? Why come and study with us? Well, you can see from the pictures displayed here that we live in an area of outstanding natural beauty, which provides lots of opportunities for outdoor living. In fact, the university has a number of societies and clubs that will enable you to continue outdoor pursuits or to take up a new challenge. But we also hold a strong academic profile as well, having reached gold standard for teaching excellence in the Teaching Excellence Framework 2017. And we were in the top 20 for teaching quality in the Times and Sunday Times League tables. We were also last year voted best in the UK from the student crowd reviews. So we do have a lot to offer prospective students. So why study midwifery, particularly at Bangor? What's great about the midwifery programme? Well, in the last 2 years, we've received 100% overall student satisfaction under the National Student Survey, saying our students are satisfied with the course in general and the information provided by staff. And 95% of our students go on to work immediately after qualifying. A lot of them primarily will work in the health board where they trained, which allows for some consistency for them as they settle into their new posts. But some may go on to further study, and there are a number of postgraduate opportunities available. We do have a midwifery master's pathway, which some students may choose to continue with. We're also very proud to say that currently we are the only university in Wales that hold the BFI accreditation for universities. This is the UNICEF Baby Friendly Initiative accreditation. That means that we have reached the required standard for education in infant feeding and specifically breastfeeding. There's a great student midwife society organised and run by the students. A good opportunity to network and meet other students from other years. They organise study days, social events, and they raise money for some important charities related to maternity and neonatal care. And not to forget that the places on the midwifery course are provided through HEIW, Health Education Improvement Wales, and therefore there is a bursary available to some students. So we thought it would be great to put some faces to some names. So starting at the top, our lead midwife for education is Sheila Brown. So she is in charge and oversees all the governance and regulatory aspects of the course. We have Dr. Mary Longworth, Dr. Jude Field, and myself, Julie Roberts, who are Year 3, Year 2 and Year 1 leads respectively. So Year 1, when you join, it would probably be myself that you'd see a lot of. Dr. Jude Field is also our course director. We are a small but growing team, and recently we've been joined by other midwifery lecturers, Lauren Irving and Samantha Fletcher. And we also have Siwan Humphreys, who has joined us as Welsh medium lecturer, who holds close ties with the Coleg Cymraeg Cenedlaethol provision. Lisa Orhan is an associate lecturer and is also a practice education facilitator. So she is the link between our department and the health boards. So this is what we're here for, really, isn't it? This is what where our interest lies. And we see we've got some lovely pictures of birth here. Birth in the water, the bottom there, and then birth on land in the grey picture, and birth in the caesarean section. But all these pictures have something in common. And that is, we don't have a midwife in these pictures. And we've done that on purpose. Because we want to show and we want to explain to students that the woman and the baby and the family should always be the sole focus of care provision. Yes, the student midwife and the midwife will be there to assist in these events, but it is the woman that should remain the sole focus. And we want to instill this philosophy into our students as soon as we start the course. So if you decided to start this journey to a career in midwifery, how would you make that step? So you'd need to apply via UCAS, that's the University and Colleges Admission Service. creating a profile and uploading all necessary information. One important element is your personal statement. This is the first impression that we get of you, and it's your opportunity to tell us a bit about yourself. You can also display some knowledge, so current thinking on midwifery and any experience you think might be related. And we would also be looking for evidence of those values and attributes that we would want to see in a student midwife and a registered midwife. So I say an important step in this journey. And we do read every personal statement that is sent through to us via application. So what other entry requirements do we need? Well, a typical offer would be made on 112 to 120 UCAS points from a range of level 3 qualifications. Level 3 qualifications would be things like A-levels, access to higher education courses and some BTEC courses, for example. You must also have achieved English or Welsh as a first language and mathematics at GCSE grade C or level 4 or above. But we also accept the level 2 numeracy and literacy units that are held within the access to higher education diplomas. If your qualifications are older than 5 years, you must demonstrate evidence of recent study. So if you've been away from study for a while or never really been involved in any healthcare education, then you may feel that you want to refresh these skills and take on maybe an additional A-level or start the access course to update your knowledge and prepare you for your study at degree level. We also look for other things in our applicants. We ask that you're able to demonstrate good health and good character. We ask you to do this by completing a self-declaration form to reveal any criminal convictions. But you should also complete the enhanced DBS check, which is the disclosure and barring service check, and also an occupational health review. You can complete these once you've accepted an offer of a place or you are already registered with the university. And it's the student's responsibility to meet the fee for these checks. So you've put in your application, we've read it and think we want to see this person, we invite you in interview. So what happens on interview day? Well, this year the interviews were held online because of the restrictions, and it is a whole day process. We want to get to know you and we want you to get to know us as well. We think it's important to consider that, you're interviewing us. You need to see what's the team like, what are they offering, could I study here? A lot of it is based around group work. It's an important element of midwifery practice. You often be working in groups with other members of the multidisciplinary team or within the community team base itself. There's also a numeracy and literacy test element where this is done online and it's at level 2, so GCSE level. There is an individual component within the group settings that allows you to display some individual knowledge on subjects that are generic to midwifery. So nothing that should catch you out. And a good way to prepare for this would be to access some of the related websites, such as the Royal College of Nursing and Midwifery. The Royal College of Midwifery has an interactive site where you can look at some courses and get current thinking. There's also the All for Maternity website that again has some interactive modules on there, and the Positive Birth Movement, for example. That's a great website to get information from. Another important website may be the Nursing and Midwifery Council website, and they're the regulatory body that regulates nursing, midwifery and allied health professional education and practice. So we mentioned there something about the Nursing and Midwifery Council, or the NMC as we call it, as I say, who are the regulatory body that govern us. How can you display this within the course? What would we expect from you within the course? Well, we'd expect you to meet the assessment deadlines and to meet deadlines set within the theoretical components. We'd expect you to be punctual and on time and attend all your shifts in clinical placement and all theory sessions. We'd also expect you to uphold that professional reputation. You need to consider that professional approach, not just in your working time on the wards or in theory time in the university, but also in your home and social life. So consider things like the use of social media sites. And this starts from the very beginning. Depending on where you're joining us from today, you may or may not know Wales has two languages. It has the Welsh language and English language. Both can be seen here on this sign, and you will see many of the signs. All of the signs in Wales have to be bilingual now, and Bangor University is a bilingual university. So although primarily our courses and the content is available in English, we do make available sessions in Welsh language. Students can complete some of their skills sessions through the medium of Welsh and can submit some of their assessments through the medium of Welsh. And I referred to before our new member of the team, Siwan Humphreys, who is our Welsh mediums lecturer and has close links to the Coleg Cymraeg Cenedlaethol. This provision enables students to receive certain bursaries for completing part of the programme in Welsh language. So exactly where would you be during the programme? Well, we've provided this map to give you an idea of how things are spread out, because the health board where our clinical placements take place, Betsy Cadwallader University Health Board, is the largest geographical health board in Wales, and it runs from the very tip of the Llyn Peninsula right through over to Wrexham. So if we look at the theory element of the course first, we look at the two stars. The stars to the left of your course, of the map, sorry, is the theory campus in Bangor. Now, our students are officially registered in the Bangor campus, but we do hold sessions in Bangor and in Wrexham. The other star to the right is the Wrexham campus. We're trying to offer a blended approach to our teaching provision as we go forward. We've been doing a lot more online sessions due to the restrictions, but we do feel it would be a really fair and equitable way to go forward to offer some face-to-face sessions mixed with some online sessions. So it means there's not too much travelling for our students. The clinical placement areas we divide into West, Central and East. So West again is the red dot nearest to the left under the star, and this would cover Ysbyty Gwynedd or Gwynedd Hospital and the surrounding community areas. Central area is the red dot in the middle, which would be Ysbyty Glan-Clwyd Hospital and the surrounding community areas. And the dot furthest to the right is the east dot, and this would encompass Ysbyty Mailer or Mailer Hospital and the surrounding community areas. During the interview process, we will ask you to make first and second choice to the areas you would like to be placed in. And this is really important because we have so much capacity for placements in each area. We do sometimes as well have provision for placements in POWIS, which enables the student to have experience of that continuity of care community model. So what are we going to teach you? What are you going to experience? Well, during the clinical placements, you will have been exposed to many diverse maternity surroundings. You'll start from very early pregnancy with some experience in the early pregnancy units, running through to the antenatal care provided both in the community and in the antenatal wards. And then coming up to assisting, first observing and then assisting with labour and birth, either in the labour wards or in the MLU, midwifery-led unit areas. And each hospital does have a midwifery-led unit annexed to it, as well as there being some freestanding birth units out in the community areas. And you would also be part of the postnatal care that we provide, assisting the practice supervisor you'd be accompanying with care for the mother and the newborn infant, both in the home and clinic environment. And this is supplemented by gaining skills in our theory components. We have some fantastic skills labs in both the Bangor and Wrexham campus where you can practice these skills. And we'll talk a little bit more about the typical skills, for example, you would experience in the first year. So how would your course be structured? How do we approach these elements of theory and placement? So this is a typical example going from week 15 in the course to week 28. Coincidentally, the student's called Julie. So see, we first start off with a week of directed study. So they might not mean any face-to-face sessions, but there would be online work and self-directed work that the student would have to complete. And then they have a block of 4 placements, which could be in any area of the maternity care provision. Then they have 2 theory weeks, week 20 and week 21, where there could be a mixture of face-to-face teaching and some online sessions, and then an annual leave week. We do try to align all our annual leave weeks with school holidays, and students currently have 7 weeks annual leave a year. Again, this is followed by 4 weeks of placement and then 2 additional theory weeks where again it could be face-to-face combined with online teaching. So what examples of content will be covered in our first year? What sort of things will you be learning about? Well, we give you a strong foundation knowledge in anatomy and physiology of general systems, and then move on to adaptation specifically to maternal and fetal systems as pregnancy progresses. We look at baby care and the midwife's first baby check that you'd be involved in once initially as the baby is born. The skills we would cover would be things like abdominal palpation, so that's feeling the mother's abdomen to see how big do you think the baby is and where is the baby lying, and fetal heart auscultation, so that's listening into the fetal heart rate. Venipuncture, taking blood, intramuscular injections, and newborn blood spot screening. This is sometimes called the heel prick test. You'd have an introduction to infant feeding, specifically tailored sessions on BFI and breastfeeding. We would also make sure that an important component of all the sessions would be the role of the midwife in supporting and optimising physiological birth processes. So an introduction, we try to embed the first year students in this philosophy of normal physiological approaches to care provision. And as mentioned before, in placement, you'd be involved in the provision of antenatal and postnatal care, in addition to observing and later assisting with labour and birth processes. So there's quite a wide and diverse array of skills and experiences you'll encounter. This picture, although a little blurred, is making reference to our future standards, the future midwife standards. We will be undertaking a review of the curriculum and a review of how the standards are applied to midwifery education. And in the cohort for 2022, we'll be starting the course with these new standards. Personally, what I feel these standards bring are a lot more creativity and a lot more consideration of the diverse role of the midwife. And I think they'll make for a very good and very valued learning experience. We mentioned before that there is some NHS funding available for places on the course. The best sources of information for this would be the Student Finance Wales website and the NHS Bursaries website award scheme. These will enable tuition fees, course fees to get paid, and some living costs. There are some criteria to this. Part of the accepting this bursary is a commitment to work in Wales for an agreed period of time following qualification and registration. But as I say, the best people to speak to are Student Finance Wales and the NHS Wales Bursary Awards system. So what can you go on to look forward to? What careers in midwifery could you possibly consider? Well, I think the most obvious one, if we look at the first picture, is that thought of the midwife, either the community midwife. Here we see a community midwife at home, a woman in labour using the ball, and it looks like she's looking at the fetal heart, listening to the fetal heart. So that's our sort of generic version, isn't it? This is the accepted version of the midwife. If we think of things like Call the Midwife. Also, there could be midwifery experiences and careers in the hospital setting with some specialised roles, both in community and hospital setting. We now have an ever-expanding specialist midwife service that deal with things like safeguarding, substance misuse, perinatal mental health, etc. Some of our students have gone off to work as midwives across the world, joining organisations like Médecins Sans Frontières and other provisions for midwifery care in developing worlds. And we do have, as part of the programme, offer some students an elective opportunity when restrictions allow to go and work in other places. There are specialist roles like midwife sonographer, so you may decide to do further training to become a midwife that does the ultrasound scans throughout pregnancy. You may be drawn to education, as I was. I started out as a clinical midwife, but loved being with students, so was drawn into education. So you may start to look at, ideas of progressing into midwifery education. Or you may aim to be a manager, a leader in the field of midwifery, and look to aspiring to roles within the immediate leadership realm, so ward sisters, matrons, looking further afield to other management posts. So that you can see that the pillars of midwifery are quite wide and diverse, and there are lots of opportunities to go off in lots of different directions. But I think most importantly is that idea of what the midwife is. And there's some quotes here from work done through some of the leading contemporary midwifery thinkers. The midwifery model of care is an essential element of comprehensive healthcare for women and their families that should be embraced by and incorporated into healthcare systems and made available to all women. In every country where I've seen real progress in maternity care, it was women's groups working together with midwives that made the difference. So this really refers to that partnership working with women, the remit of the midwife's role in normal physiological process of being the advocate for women. So thank you for listening. I hope you've enjoyed the presentation as I look forward to receiving applications from you.